Hi everyone, thank you for visiting my channel. My name is Taylor and I'm a US American that's been working and living in Germany these last few years. Last week I posted a video on the public and the political response of Germany due to the coronavirus pandemic. I'll link the video up above. And this week I wanted to actually do a deeper dive into what exactly the German healthcare system looks like. So there's a few topics that I want to discuss during this video. First, I'm going to just discuss some basic facts about the German healthcare system. How do you categorize it? How do you acquire it? Things like that. Then I want to talk about the coverage that you have. What exactly is covered when you have this health insurance and how does that work? Then I would like to talk about the cost, and I'll use my own personal experience. And then finally, exactly what my personal experiences are, so both positive and negative with my interaction with the German healthcare system. As a disclaimer, I am not a medical professional or anything like that. I've just had normal contact with the healthcare system like probably a lot of average people have. And I am going to be comparing the system quite a bit to the US system since I grew up in the US, and also the UK system since I lived in Scotland for a year and a half. Before I get going, if you like my videos, it would mean a lot to me if you'd subscribe to my channel. I'll be doing quite a few videos about life in Germany and traveling around Germany, and also just traveling videos in general once traveling is possible again. The German healthcare system is what Americans would probably refer to as universal healthcare. It's a multi-payer system, which is different from what Bernie Sanders, for example, was proposing, a single payer system, or what the United Kingdom has right now. And that just means that with a multi-payer system that we have multiple different insurance companies, and then you pay as a normal resident to these insurance companies and they insure you. In Germany, you can get both public and private health insurance. So the majority of people get public health insurance. I think the statistic that I saw was 86%, so that's definitely the vast majority. A smaller percentage get private health insurance, and then there's another type of insurance you can get if you're like in the military or the police or something, like have a high risk job or something like that. So pretty much, I guess the only benefits of having a private insurance would be if you're young, you pay a lot less per month, which is nice, but obviously this increases as you age. But people that maybe have like a higher paying job will then pay less at the beginning, and you have to have a higher paying job. They have a minimum income that you have to reach in order to even be able to apply for private insurance. And they're able to also, I think, reject you if you have any pre-existing health condition. So yeah, I'm with a public system here in Germany, and it's very egalitarian. It doesn't matter how much money you make or anything like that. You are treated as an equal, and you are given good quality health care. I think that the way the German government views health insurance is also a lot different from the way that the American government views health insurance. So in Germany, healthcare isn't just a privilege, it's a right for every single person. We all deserve a right to basic healthcare, essential healthcare. And in the US, I think that there are just millions and millions of people that are left uninsured because they just can't afford health insurance. So it's definitely a different way of looking at healthcare. And also, I think that prevention is something that's placed a lot more emphasis on. So for example, they have some like programs that make it more likely that you're going to stay active, like live a healthy lifestyle, and therefore have less complications in the future. So a lot of companies will offer some sort of like reduction of price or even free gym membership, or with your health insurance company, you can sometimes get like a bonus heft where if you get certain things done in a year, that you can get like discounts on elective procedures. Yeah, so that actually leads me perfectly to what is exactly covered in with health insurance. So I mentioned the difference between essential and elective. So you break your arm, you get diagnosed with diabetes or cancer or anything like that, like you go automatically to the doctor and that is covered. You go in, you hand in your card, they swipe it, and you get treated. You don't have to pay any kind of crazy fees or anything like that. Something like, for example, cosmetic surgeries are not covered 100%. Definitely, you would have to pay, and this is every insurance provider is different in what they exactly cover. And they have like a hotline that you can call and get information about that. I don't have like obviously all the information about what exact procedures are available and which aren't under these health insurances, but that's something that you can easily find online or by calling the health insurance provider directly. Health insurance also comes with additional, I guess, care that you wouldn't get in other insurance plans. So you have, for example, accident insurance, you have long-term care insurance, you have dental and vision insurance, which is something that I know you don't have in the US, which I think is insane because your teeth are a part of your body and your eyes are a part of your body. So for whatever reason, I don't understand why that's not included in American health insurance. You do have something called Zusatzversicherung, and this is just like an additional insurance you can get if you know that you have like a problem area. Can you like, I guess. So for example, for me, I have really bad teeth. I don't know why. I have since I'm a child. I always have cavities and I always have problems. And I should get an additional insurance that would provide then like more intensive dental work, which I probably will in the future, not really now, but in the future I probably will. Then it's good to have like an additional dental insurance that covers higher costs for more complex procedures, I guess you could say. So now something that's very important to a lot of people, I think especially US Americans, because they always talk about like, yeah, universal coverage and universal healthcare sounds great in theory, but then we have to pay crazy amounts of taxes or whatever. And I can tell you, I've compared with other people what they pay for their health insurance in the US, and I pay either the exact same or a lot less, typically, than my American counterparts. So what we have is actually a system where you pay a certain percentage of your paycheck. I only can speak like from, I guess, my personal experience because I can see how much is taken off my paycheck every month, but I pay 7.5% off my paycheck and then my employer matches that. So in total, it's 15%. And this is probably one of the highest amounts, that and like income taxes is probably one of the higher amounts that's taken from my salary every month. But it's amazing what you get with that. You know, you obviously, like I said, you go in, you don't have any co-pays, you don't have any hidden costs. I mentioned this in my last video when I was talking about COVID-19, that the American government had to go and give a press briefing and talk about how people would be tested for free and that they would be treated for free, which I'm pretty sure it was a lie. I think that that was also debunked because it's not true that all insurance providers will treat people for free. But that wasn't even a question in Germany because we trust our healthcare system and it's a lot more transparent. You know what you're going to be charged, and a lot of times if it's, like I said, essential care, which COVID-19, if you need to be hooked up to a ventilator or you need special treatment, you wouldn't pay for that because it's essential. So our Chancellor Angela Merkel didn't have to get up and specifically tell us that we wouldn't have to pay secret costs. I don't know. The system, I feel like, is just a lot more transparent somehow here. Finally, when it comes to costs, I just also wanted to talk about how the government works to cap certain costs, whereas in the United States, some of these costs kind of run rampant. Like I know some people take Ubers in the United States instead of ambulances because ambulance rides can cost a few $1,000s. And in Germany, this is not a thing. They do have a fee to it to kind of tamp down on people taking the ambulance unnecessarily. So I think it's probably around, like, I can't imagine it would be more than like $30 or something like that. I'm not sure exactly the cost, but those costs are capped because they don't obviously want people who are in distress and need immediate medical attention to think in their back of their minds, can I afford to take an ambulance? This is just ridiculous. And then another thing that is capped is drug prices. So this is something that I think is really great. There is a trading system in Germany. It's a bit complex. I'll leave a link below that explains it a bit better than I will. But you pretty much have these negotiations between two entities. So one entity that represents insurers that obviously want to keep the drug prices as low as possible. And then you have the drug companies, which obviously want the prices to be as high as possible, that way that they can make more profit, that they can invest more in R&D and things like that. And they have to come to some sort of agreement that both parties are willing to accept. So that way you don't have drug prices that increase 300% overnight or whatever it is that's happening in other parts of the world. So the drug prices are kept quite reasonable, and this isn't even to say anything about what we as consumers pay, because for example, I know I'm not like on a bunch of medications, just birth control, for example, I go in and I only pay €5 or something like that, because these costs are capped for the consumer. So consumers are expected to pay kind of a small fee when they go to the pharmacy to pick up their medications, but it's very minimal. You never hear about people rationing their insulin here. It's just not really a thing. Drugs and medicines are made affordable for everyone. So finally, I just wanted to discuss some of my own personal experiences with the healthcare system here. I've had primarily positive experiences, but a few like negative, not like really bad experiences, but a few negative experiences, I would say. One thing that I thought was interesting when I moved to Germany was that Germans have a lot of private practices. So they're typically run out of kind of like apartment buildings, but they've been hollowed out and made into like a commercial property almost. But you walk through and it kind of almost feels like the layout of an apartment, and they'll have like 2 or 3 doctors that work in the same place and a few nurses working. So they're quite a bit smaller. Whereas I know where I'm from in Wisconsin, we have like in my town, one giant clinic that has a bunch of different departments in it. So you can get your like blood taken at this place and like immunizations here. And there's the like emergency care, like just a big clinic, I guess. And I think you have cooperatives here too, but you don't see them that often. And if you have an emergency, you also would then go to the hospital. But I think that's something that was a big difference that I noticed when I first moved here. I guess one of the negative experiences that I've had is when I first moved to the city that I live in right now is trying to find a doctor. So it's always good to have your GP or like your general practitioner. And I had to find first a doctor that I both liked, had good recommendations and good reviews, and that was near my apartment. And because there is, I don't know if it's an actual problem, but I know that there just aren't enough doctors, period. I think this is true in a lot of countries. And sometimes it can be difficult to find then a doctor that accepts new patients. And I also had this, I think, for my gynecologist, that I had to first go to a few different ones to find someone that was taking new patients. My experience interacting with doctors has always been very positive. I never feel rushed or judged or anything like that. I think that the German attitude and mentality of efficiency sometimes comes through, that you don't get a lot of small talk, and sometimes you don't get like nice changing stations or anything. They just like tell you to strip. I don't know if you go to the gynecologist in America, they'll like be very gentle with you, put blankets over you. You don't get any frills, I guess I would say. Maybe this is TMI, whatever, in German doctor's offices. But I can really like compare only to my experiences again with the UK system, where I almost felt like I was on a factory line. I remember one day I went in and I was having problems with asthma, and I needed a new inhaler and a new prescription for that. And I also needed a prescription for birth control. And I remember going in and I had these 2 things that I wanted to discuss, and they're not very long. And I remember my doctor told me I had 10 minutes. And if we didn't finish the consultation in those 10 minutes, I would have to make another appointment. So I felt really as though I was kind of on a conveyor belt of patients, and they just needed to kind of tick off all these patients during their day. And I didn't feel heard, and I didn't feel like they got to spend quality time with me to get to know what was really wrong with me. I don't know. That was, I think, one of the worst experiences, because health is something that's so personal to people that I really wanted to feel like I was being heard. So I haven't had that experience in Germany, even though we also have a universal healthcare system here. So yeah, I guess those are my personal experiences, and those are the main points that I wanted to discuss with you today about the German healthcare system. If you have any questions about how to acquire health insurance when you're planning on moving to Germany, what it's like as a student acquiring health insurance, any of those things, I can do my best to answer in the comments. Like I said, if you enjoy this video, please like it and subscribe to my channel, and I will see you guys next week. Thanks. Bye.